So tell me a little bit about yourself and the organization that you represent.
I am Melissa Clark. I'm the Associate Director at AHEC West. We do a lot of informational education at the Area Health Education Center. Every state has an Area Health Education Center, probably multiple ones. We are a great resource to work within our communities, rurally and urban areas. Our particular organization is in the mountains of Western Maryland in Allegheny County. And we work a lot with all kinds of grants. We have 24 grants within our organization that we staff and deliver to the communities.
What role do small community-based organizations play in addressing these social determinants of health?
I feel as if small organizations and small communities are able to address these because we are trusted. And being a face of an organization in a community where you know a lot of people, it just generally helps us be trusted, and people come to us for information and rely on us for information. Also, just looking at the economic stability of a region and working with folks to make that better. All of that comes into play with the social determinants of health. And of course, the social and community connections, which
So I'm curious what the word rural means to you personally, and why do you think that people in your area consider themselves rural?
rural to me means so many things. I grew up in a rural community. It's good and bad, to be perfectly honest. It has challenges when it comes to certain things like how people are viewed or how they view one another, but it also is a true sense of community. Living rural makes you understand and appreciate so much. It makes you understand, the fruits of one's labor in a lot of ways. I grew up in a farm community. So when people were working at their farm, or you're out helping in a farm, you're really to the earth, you're in the earth, and that's really the epitome of everything. And I think living rural, although it does have challenges at times, it's a sense of community, and it's important, for people to understand that. I think the tough part, for a lot of people that live in rural, is they maybe don't want to believe that there are issues that they can't tackle themselves. That, why do we need someone else to come in and help us do this? Someone from downstate, that's the famous quote. Um, but the reality is we do need that help. We need people who are willing to help us solve problems that are beyond our scope, and help us understand, just like it's important for us to help them understand, what it's like to live rural.
So please share anything about experiences in your area relating to like health services closing or being difficult to access.
So in our area, we have had some incidences where we have had health providers leave the area. A lot of times this happens for multiple reasons. Um, I would say that the biggest reason is there is not a lot to do, that perhaps their spouse does not want to live here any longer. Their children, they want to have a different education or more diversity, because a lot of times in a rural area, it's not very diverse. And so we have had a lot of changes happening in Western Maryland through the years. At one point, a lot of our doctors were aging out and were not being replaced. So part of our role at the Health Education Center is to help recruit, help understand the importance of rural living. And that is a challenge. A lot of times the physicians that we do have come and just work 3 or 4 days, stay overnight, leave. They don't reside here. Some of the smaller doctors' offices are being purchased or pulled in. Let me start this over. Some of the smaller doctors' offices are getting pulled into the corporate setting at the hospitals, which is fine in a lot of ways. But I think some of our rural residents don't see it that way. They like to be able to just call and have Dr. So and so, not have to see a nurse practitioner, not have to see a PA. But that's all in the education and understanding that it's okay. It's okay to have to see those people, and sometimes even better, because a lot of times you may get more time with those folks versus a physician who's super busy with a million things going on.
So, talk a little bit about how people from rural areas might portray like urban centered agencies coming into their community. So, you mentioned this a little bit, even in your definition of rural, but say a little bit more about sort of the first impressions, and if you would like to go into any immediate advice of like how to make that a better impression, feel free to elaborate.
So folks in rural communities are very protective of their community and their position in the community. And I think that it's important that when a state agency comes in to a rural community, that they understand that they get that there's going to be hesitation, there's going to be a sense of what are these people doing here and who do they think they are. It's important to come in, make a connection with a couple folks that are trusted individuals within the community, and take it from there. But super important to have those trusted relationships, and we have those. I think it's hard sometimes for the general population to understand that, but when you're in an organization and you work with all kinds of people from all different areas, and you have that relationship, and then you can take that relationship to the people, so to speak. It's they trust me, so they're going to trust them because I trust them. If an urban organization is coming into a community to help understand, educate, relate to a specific group, it's super important that group understands that they've already kind of been vetted by somebody. And in that, I mean, say someone is coming from the state of Maryland Health Department in Baltimore, and they're coming because there's a specific issue occurring in Western Maryland that they want to understand better in order to help us better, they need to know that they're trustworthy. And in a rural area, with having myself or one of my colleagues who we've talked with them, we've helped them understand to the degree that we can, that then the general population or other organizations say, oh, okay, they've already worked with AHEC. I get it. They're going to be fine. We're going to give them what they need and help them with that. It's really a trust and understanding, and not coming in feeling, well, I'm from this city, so I do this and I do that. Because even if you live rural, doesn't mean you haven't been to 47 countries. It's just you live rural. It doesn't mean it's a bad thing.
So tell me a little bit about what do these urban centered agencies often do that can be really frustrating?
Working in a rural setting in an organization, the urban folks overlook certain things such as education, thinking, oh, they're just whatever. They went to their local community college and they've lived there their whole life. When in reality, a lot of us have lived here, moved away, and come back and want to raise families here and live here. So it's important to never assume anything about someone. And that's not just rurally, that's just generally. but especially in a rural area, because you just don't know what the story is. And I think that the biggest mistake someone can do is come in and say, okay, we're going to do this now. If you want this money or you want this collaboration, this is how we're doing it. Because what works in a city or a suburb of a city doesn't necessarily work in a rural area. And those rural people are going to push back and not trust. It goes back to the trust thing. And we're going to be like, no, that doesn't work here. Understand that that does not work here. And this is what does work here. And we can come to an agreement and help guide anyone through that. And I'm not saying it's our way or the highway by any means. Most of us are very open to any kind of anything that'll help. I mean, we live in a very tough area. A lot of us in rural, you think about housing and transportation. The opioid crisis is out of control where we are. We're going to take advice, but we want to hear you just as much as we want you to hear us.
Leading into the positive side of that, what are some ways that these more urban-centered agencies can better support rural-based CBOs?
So the advantages of having an urban organization come in and help a rural organization is always resources. They tend to have great resources, great internal systems and develop systems that sometimes we just simply can't afford. So we're able to piggyback on that, and that's going to be to our advantage and their advantage. And I think that that's super important. The pockets are a little deeper, so to speak, and there's more dollars, and therefore they're able to do more and provide more to the organizations in a rural area and the people in a rural area. The best part about urban agencies coming to rural area is sharing their resources. They're able to share some of the larger resources that we may not have access to, or we may not be able to get help with a particular problem because we are small. I know we use the state of Maryland. We use the OOCC for a lot of work that we do, just to gather information, to feed them information, to collaborate on things. Our state Department of Health is fantastic in helping us. And that's really key as well, because they're able to bring some resources that we don't have, that we can't access, that we don't have the money to or the access to. And they're able to bring those resources in and say, okay, here's this. Can we count on you guys to help us with this? And in turn, you're going to be able to receive this information. I think that the databases that can be provided sometimes and to be included in are super important for the work we do. I think that coming in and expecting a certain timeline, a certain way of doing things, and not realistically listening to the agency can be bothersome. But we love to see people come. We love for visitors to come see us. We have a Healing Allegheny Coalition. And if we get someone that comes from an organization outside of our area, from Maryland Department of Health, or we've had a couple of the congressmen that have joined our coalition calls and such. It's so important. It makes us feel valued. It makes us feel like we're part of the solution, that we're helping with this problem, not just in our own area, in our own state, but even bigger than that. And I think that matters to rural. We want you here. We want to learn more of what you're doing. We want to know what your resources are. We want to work collaboratively with you. We want you to understand where we come from, so and likewise we'll understand your perspective. And I think that that's all really important, because the resources that we can provide each other is invaluable if we work together.
What are some thoughts of how to help keep people anonymous so they feel safe coming to that space?
If there's a breach, and it's typically very minimal that something happens, we have a form that's filled out and we report to our board every quarter what it was and how many. And it's usually typically like, I forgot to encrypt the email that I sent with a person's name, something along those lines. But I'll tell you, with the grant that we're working on, we're getting into the distribution of naloxone as well as fentanyl test strips. Well, number one, it's very controversial in a rural area. We've been doing naloxone. People still have their own feelings about that. But to get into fentanyl test strips and to do that in a manner that's private is super important. So, because even some folks think it's just ludicrous that we would even do something like that. But it saves lives, and we know that. So we have to be discreet in how we do it, not undermining, not hiding, not doing it out a back door, but discreet. And we have a couple of methadone clinics that are the same way. They're discreetly positioned in areas without a lot of signage, without a lot of hoopla, that folks can go in and very easily be seen. Our health department and the clinics there, people are able to walk in there and no one knows what kind of services you're getting there because it could be a multitude of services. So that helps with some of the discreetness when it comes to small town gossip.
Well, is there anything else that you would like to share that could help these urban-centered agencies, particularly health departments, to better understand or to more effectively work within rural communities and with rural CBOs?
I think I would say some of my final thoughts are give up some of that ownership. And I'm not saying don't own it, but give up a little bit of that collateral and work with a community health organization that can do those things and partner with them, understand their mission and their objectives, and partner with them, work, because we're going to be a huge ally and we're going to make their lives, health department staff and their lives a lot easier because we're going to be able to work prevention and treatment and whatever else is happening within our communities in a way that they might not necessarily be able to.